This is KAFTAN TV Newsroom. The headlines. NCDC sets up emergency measures for cholera crisis. Good afternoon. It's good to have you join us on the news at 1, reaching you live from the nation's capital, Abuja. I am Olamide Al-Hassan. And now to the news in details. The Nigeria Center for Disease Control and Prevention, NCDC, has expressed concern over case fatality rates from the ongoing cholera outbreak in parts of Nigeria, with case fatality rate of 3.5%, far above the national average, placing the country at high risk of increased risk of cholera transmission and impacts. In response to this, the Nigeria Center for Disease Control and Prevention said it has activated the National Cholera Multisectoral Emergency Operations Center to coordinate response efforts, support affected states, facilitate rapid communication, data analysis and decision-making, mobilize resources, and enhance case management, surveillance, and public awareness. Addressing the media in Abuja, the Director General of the NCDC, Dr. Jide Idris, highlighted the severity of the outbreak, which has led to 1,528 suspected cases and 53 deaths across 31 states and 107 local government areas.
A total number of 1,528 suspected cases and 53 deaths have been recorded across 31 states, 107 local governments, with a case fatality rate of 3.5% since the beginning of the year. 3.5% is the average now, and the national expected average is just 1%. So we find these fatalities as not just statistics, but a significant loss of loved family members, spouses, and parents, and often a seasoned healthcare worker and team member. This situation is likely to be compounded as the rainy season intensifies. In response to the rapidly increasing cholera cases, a dynamic risk assessment was conducted by subject matter experts on cholera outbreak situation in Nigeria just last week. The subject matter experts were drawn from relevant ministries, Ministry of Health, Environment, Agriculture, Water Resources, etc., relevant federal departments, agencies, stakeholders, and our major partners. The outcome of the risk assessment placed the country at high risk of increased risk of cholera transmission and impact. The risk levels are 4. We have it low, medium, high, and very high. This high risk placement demands our immediate and coordinated actions, and therefore necessitated the activation of the National Cholera Multi-Stakeholder Emergency Operations Center, EOC, in Nigeria today. The decision to activate the EOC underscores the gravity of the situation and our unwavering commitment to protecting the health and well-being of every Nigerian. The Emergency Operations Center will serve as a nerve center for the coordination of response across the country. It will also support affected states and local governments, facilitate rapid communication, data analysis, and decision-making processes, mobilize resources, strengthen surveillance and diagnostic capacity and capabilities, enhance case management, training and intensify public awareness and community engagement activities.
The NCDC boss also discussed vaccine distribution issues, including limited global supply and manufacturing, as well as coordination with the National Primary Healthcare Development Agency for vaccine distribution planning.
Vaccines. Collaboration with National Primary Healthcare Development Agency. Yes, we are collaborating. In fact, the DG of NPHCD and I discussed extensively yesterday because it's a collaborative effort. NCDC does not deal with vaccines, but we also help again when vaccines are available in distributing. The fact is that for most diseases that require vaccines, I have not heard of a situation where adequate vaccines are available. The reason being that the demand for vaccines is far in excess of supply. Unfortunately, we don't manufacture those vaccines in the environment, so we need to depend on people who manufacture. Unfortunately, again, for cholera vaccines, very few companies or whatever it is do vaccine globally. And let us also know that cholera is not only in Nigeria. It's been found in many other countries nationwide, especially Asian countries, other countries. So all these countries also now fight to purchase these vaccines. Where there is a dearth in provision or supply, they are going to have shortage in various countries. That's precisely what is happening. I also do know that the Minister for Health approached Gavi requesting for these vaccines. We will not get all we need. Let's be clear. So when they come in, it's NPHCDA will distribute based on their criteria for distribution, not us. Vaccine alone cannot prevent cholera. Number one, you use a vaccine for people who are healthy so that when they catch disease, they don't get sick. You understand me? So if you don't use the vaccine as at the right moment, it's a waste of time. Now, so it's a combination of control methods. We also know that what cholera is a disease related to poor access to water, hygiene, and sanitation. Once we address all those, we are going well into reducing that thing, with or without vaccines. Are you with me? Unfortunately, all those water, sanitation, personal hygiene are not our direct responsibilities. And that's why in the context of One Health, we need to partner and collaborate with various sister agencies, the Ministry of Environment, Agric, Water Resources, even education like you said, school health, etc.
The NCDC-DG called for a multi-sectoral approach involving water, sanitation, education, and other agencies to adequately address the underlying issues contributing to cholera outbreaks in Nigeria.